back to The Buzz. I'm Baylie Barnes. Today I'm with Dr. Steve Cochran from the Pediatric Dentistry. Thank you for being here today.
Thank you for having me.
Great. So how long have you been in dentistry?
I graduated from my pediatric dental residency program in 1993 from the University of Kentucky, finishing dental school from University of Florida in '91.
And then, so how long have you been in Jacksonville?
Moved to Jacksonville July of '93 and have been in practice with Dr. Barry Setzer, and then recently joining our practice Dr. Flavio Soares and Dr. Karen Hubbard.
Great. And then where are you guys located?
We're located right over in the south side area, right off of Bay Meadows Road, Phillips Highway area.
So what's the age range of the kids that come to see you?
And the American Academy of Pediatric Dentistry recommends having the first child see the dentist 6 months after the first tooth erupts or at a year of age. So we start to see, or we recommend seeing our first patients at about a year of age, and then beginning the cleaning basis every 6 months with our periodic dental examination cleanings.
And then, so how old do you go up to?
Well, we will see typically most children are young adults up to 18 years of age, but we do service the special needs population in the community, and we'll see them a few years beyond that as well.
Oh, that's great. So then what are some of the different accommodations that you give to these kids to make them feel more comfortable coming in to see a dentist?
Well, going to the dentist early on can be a little nerve-wracking, so what we offer, we allow our parents to come back with the child so they can feel comfortable, so they know who they're with. We have dental hygienists and dental assistants trained specifically to work with the young children as well as the adolescent and teenagers. We have TVs in the ceilings. We have the laughing gas when we're doing our fillings. We offer sedation service if needed, and we also offer hospital dentistry if needed as well. But we just try to make everything a smooth and relaxing environment for that particular population.
Great. And then do you just do dentistry, or do you have like other parts of like orthodontistry, things like that, along with you? Or?
Sure. Myself, Dr. Setzer, Dr. Soares, and Dr. Hubbard, we're all pediatric dentistry, so we typically do the fillings, the oral examinations, planning the treatment plan after properly diagnosing the child. But we also have the privilege of having an orthodontist, Dr. Mitchell Levine, that visits our office each Thursday. For the children that may need the sedation service with some of the dental care that's provided, we have a pediatric anesthesiologist, a Dr. Dennis Stone, that visits our office on Tuesdays. And as I mentioned, we also provide care at Wolfson Children's Hospital, being affiliated downtown with the local children's hospital.
Great. And then so why did you choose dentistry as a career path?
Well, love the sciences, love kids, okay, and I love dentistry, so going through my training, I just, in dental school, I thought about being an oral surgeon at first, but met the pediatric dental chairman and got really involved with the pediatric clinic, and it really kind of planned out perfectly for me, so I'm very happy with it.
Great. So what's the most difficult case that you've had to deal with for pediatrics?
Well, I think it's dealing with the children that may have the early childhood tooth decay, the little babies with the baby bottle tooth decay, because you're dealing with a very young population. The parents are uncertain what type of care is going to be provided, and we want to make sure it's the safe and the most comprehensive quality care we can provide. So that's probably I wouldn't say it's a challenge, but I just want to make sure everybody's taken care of in the proper manner.
And then can you explain a little bit more about baby bottle decay?
Yes. Basically, unfortunately, in about 10% of the population, the children that are fed at nighttime with a baby bottle, and in some cases nursing, the sugars from that milk product causes acid to form in the mouth, and that acid causes the holes or the cavities. So a child that feeds for a prolonged period of time in the evening, and even during the day, a high frequent feeder may be at more risk for tooth decay. And unfortunately, in the 1 to 2 to 3 year range, those cavities often form on the upper front teeth.
Oh,
so
wow.
that's what we call baby bottle early childhood tooth decay.
And then from there, like, do they have to have surgery for it, or like to fix the issue? Or
Well, you do want to fix the cavities, because the cavity is actually a bacterial infection, and it can continue to spread, and it could cause some damage not only to the tooth, causing a toothache, but also systemically. So we want to make sure that the teeth are treated effectively. And those front teeth will be with that young one till about 7 years of age. So they're going to have them for a few years right there.
Definitely.
Yeah.
Wow. So do you guys have any plans for the future with your practice?
Well, we just want to keep growing. We always welcome new patients, and we want to provide the best quality care to what we can to the citizens of our fair city.
Awesome. So then, do you guys partner with anyone in the community as well, or?
Well, all members of our, each of the doctors that we're associated with in our practice belong to the Florida Dental Association, the American Academy of Pediatric Dentistry, and the American Dental Association, but we do quite a bit of charity work with the local Give a Kids a Smile event that's held every February at the Salzbacher Clinic in Jacksonville. And then we also work with the Florida Dental Association Foundation, which recently held the Mission of Mercy event at the Prime Osborne Center here just recently in Jacksonville, providing service to several thousand people in need of dental care.
Oh,
So
wow.
it was a good event.
Awesome. So if people are looking to to be one of your new patients, how would they reach out to you?
Well, they can contact our office. Our telephone number is 904-733-7254, or you can contact us on the web at setzerandcochran.com.
Great. And thank you so much for coming in today.
Yeah, thank you, Baylie, for having me.
All right. And thank you so much for watching at home. We'll see you next time on The Buzz.